This is part 2. So let's continue with endometrial hyperplasia. Endometrial hyperplasia is the condition where there is an excess amount of estrogen, which is unopposed by progesterone, right? So usually if estrogen raises, progesterone has to raise proportionally, but in disease conditions when there is only excess estrogen, endometrial hyperplasia results. So the cases include, for example, obese women who have obese people have adipose tissue which has aromatase enzyme in those cells, adipose cells, and this aromatase enzyme secretes a very large amount of estrogen. So this estrogen is going to go to the endometrium, and it's going to result in hyperplasia of the endometrium. So there are actually two types, or any other conditions where estrogen rises. That can be the estrogen only contraceptives that has been used in the past. Now contraceptives include estrogen and progesterone as well, and also hormone replacement therapy in postmenopausal women, and granulosa cell tumor, which is an ovarian tumor. It's a sex cord tumor which secretes large amounts of estrogen. So in case of the endometrial hyperplasia, we have two types. First is more benign type, which is associated with the endometrial hyperplasia without atypia of the endometrial cells. So endometrial cells are well differentiated. They have no problem. They're usually benign. The only thing is that endometrium is hyperplased, if that's even a word, and there's usually no progression to malignancy. So it's a benign one, the first type of endometrial hyperplasia. The second type is associated, like 20 to 50% is associated with malignancy. This is endometrial hyperplasia with atypia. So we have atypical endometrial cells here. Atypia. Whatever. So you see atypia here. So this is associated with malignancy, the endometrial carcinoma, which is quite common cancer in women, unfortunately. So now let's get to the endometrial carcinoma. So we see that there's two types of endometrial hyperplasia. One is without atypia, which is benign, and the second one is, which is sometimes benign without atypia, can also progress to carcinoma, but is like only 5% or something. It's very rare. But in case with the ones with atypia, it's probability is much higher for it to progress to the endometrial carcinoma. So let's talk about the endometrial carcinoma. It's unfortunately very common carcinoma in the United States and all Western countries. So there are two types of endometrial carcinomas. So, two types. So one is endometrioid endometrial carcinoma, and the second one is serous endometrial carcinoma. Serous. So endometrioid is more benign. Of course, it can progress to malignancy, but the probability is less higher than the serous one, which is more frequently malignant. Malignancy is the probability is much higher for it to convert into malignant type, right? So the differences between them is during the endometrioid carcinoma of the endometrius, the usual women population affected are the ones during the perimenopause, menopausal women, the ones that are starting the menopause. But in case of the serous endometrial carcinoma, usually people affected are postmenopausal women with the atrophy of the endometrium, right? So the risk factors include obesity, diabetes, hypertension, infertility, and also exposure to unopposed estrogen, and the ones that cause the endometrial hyperplasia. The important genetic background for the endometrioid carcinoma is the mutations in mismatch repair genes. You remember the mismatch repair gene deficiency is causing the syndrome, the Lynch syndrome. And the second genetic base for the endometrioid carcinoma is the mutation of pt.2 tumor suppressor gene, which is both of those are usually the genetic basis for the endometrioid carcinoma. In case of the serous carcinoma, we have mostly TP53 mutation, which has higher percentage of malignancy, right? It's the tumor suppressor gene as well. This is associated with serous endometrial carcinoma. So the 5-year survival rate for early endometrioid carcinoma is pretty high. It approaches around 90%. But with the increasing stage, if it's discovered in a later stage, there is a very drastic decrease in the survival rate. But in case of the serous one, it's the probability of the survival, the rate is very low, and usually it converts to malignancy very soon. So if it's not somehow discovered in a very early stages, it's really difficult to treat it. So that was the endometrial hyperplasia and endometrial cancer carcinoma. And now let's talk about what do we have in here. Okay, let's talk about the polycystic ovary syndrome. This syndrome is associated with several problems. The polycystic ovary syndrome is usually characterized with the hirsutism and acne. This is due to the increased levels of testosterone. There's also the polycystic ovary. That's this syndrome. There's also a high chance of infertility, and it's very commonly associated with the obesity and other associated problems like hyperglycemia and metabolic syndrome. Now, etiology is actually unknown. It's also associated with the insulin resistance and obesity. There's association with obesity and progression of the polycystic ovary syndrome. The criteria are anovulation and infertility, hyperandrogenism, which is due to the increased levels of testosterone, causing acne, alopecia, hirsutism, which is hair, like facial hair in women, and increased levels of testosterone. There are enlarged polycystic. There are many cysts on the ovaries, and the treatments are usually weight loss. Also, there are some drugs that can be used, like for example oral contraceptives, metformin, which is I think for diabetes. And if the if the woman wants to have an ovulation, there's a drug for that as well. So complications include cardiovascular disease, type 2 diabetes, malignancy, endometrial cancer, and pregnancy loss. So those two are associated with obesity mostly, and those two with the ovary syndrome itself. Okay, the next disorder I'm going to talk about is actually not written in here. I have to find it. This is the leiomyoma. Leiomyoma is a disorder which is characterized by the benign accumulations of the muscular cysts or something like this, the smooth muscle accumulation in the myometrium. So you see here, like for example, this is myometrium. So there's accumulation of those muscular tissues in the myometrium, which causes for the myometrium to increase in size. They're usually, with the palpation, they're usually very firm, so they are also called a fibroids. And they're actually very common benign tumors. For 30 to 50% of women of the reproductive age are affected, but it doesn't usually progress to malignancy. So those are benign